And David, before we get started, you may want to turn it to presentation mode.
Let's see. Do you not see presentation mode at the moment?
No.
Interesting.
If you have two screens, you may need to change the screen if you have double screens.
And I usually have two, but I only have one today. Let's try that again. All right, how are we now?
Same thing.
That's interesting. I wonder why that is. Let me see if I can just share. Maybe instead of sharing the app, I'll just share the screen as a whole, and we'll try that. How about now?
Perfect.
Okay, great. Hi, everyone. Thank you for joining us for this webinar on clergy well-being and burnout. My name is David McClung. I'm with the University of Texas at Austin and the Texas Institute for Excellence in Mental Health. We're excited to be able to have you today for this presentation brought to you by NTAC, or the National Training and Technical Assistance Center for Child, Youth, and Family Mental Health. And so this is, again, a part of a series that we've been doing, looking at the role of faith communities in supporting youth and family mental health. And as a piece of this today, one of the things that we want to be able to talk about is the role of clergy, and recognizing that around 25% of individuals consult a clergy member with a mental health concern. One of the things that's important with this is also then us thinking about how we support the well-being of clergy so that healthy clergy are able to support the health of the youth and families who are consulting those clergy with that mental health concern. With the idea that otherwise, without that, there may be risk of clergy either giving advice that may not be as beneficial, or perhaps being less likely to make referrals to mental health professionals. And so I think one of the key points in which we are really kind of hoping to focus on today is just recognizing that the role of clergy is really unique in a lot of ways. And that as such, it requires us really being able to think through how we support those clergy members in order that, again, they can support those families and those children and youth to a higher degree. And so before we begin, just as a disclaimer, this presentation was prepared for NTAC under a cooperative agreement from the Substance Abuse and Mental Health Services Administration, otherwise known as SAMHSA. All material appearing in this presentation, except that taken directly from copyrighted sources, is in the public domain and may be reproduced or copied without permission from SAMHSA or the authors. However, citation of the source is appreciated. We ask that you do not reproduce or distribute this presentation for a fee without specific written authorization from the NTAC. This presentation will be recorded and posted on our website, and this event is supported by SAMHSA of the U.S. Department of Health and Human Services, HHS, as part of Financial Assistance Award SM-20-008 over 5 years from 2020 to 2025, with 100% funded by SAMHSA and HHS. At the time of this presentation, Miriam Delphin-Rittman served as Assistant Secretary for Mental Health and Substance Use and Administrator of SAMHSA. The contents are those of the authors and do not necessarily represent the official views of, nor are an endorsement by SAMHSA, HHS, or the U.S. government. In the case of any security issues that may occur, the session will immediately end and will not resume until using the same join link. However, a separate email will be sent to all participants with further instructions. So before we begin, I just want to provide a very quick overview of the NTAC. We are a multidisciplinary team, as you can see, that consists of a number of different partners, including CARS, or the Center for Applied Research Solutions, Georgetown University Center for Child and Human Development, Change Matrix, MedStar Georgetown University Hospital, the American Academy of Pediatrics, Youth Move National, FREDLA, which is the Family Run Executive Director Leadership Association, and the University of Texas at Austin with the Texas Institute for Excellence in Mental Health. Our goal is INTAC is for all children, youth, young adults, and families with emotional or behavioral health needs to be able to access evidence-based treatment and services in a well-coordinated system of care. Some of the examples of our key audiences include state and local agency leaders, the mental health workforce, including social workers, clinicians, home visitors, etc. We also seek audiences of primary care providers, school workforce, community-based providers, peer support specialists, family partners, and youth partners. As part of the INTAC, we are very fortunate to be able to provide no-cost training, technical assistance, and resources. And so to the right, you'll see a list of some of what those things are, including individual consultation, peer learning exchanges, customized coaching, training academies, communities of practice, 5 Things Digest, podcasts, practical tools, and more. And so today, we're very fortunate to be able to hear from Dr. Regine Procheld-Bell from Duke University with the Duke Clergy Health Initiative and Global Health Institute. And we're also very fortunate to hear from my colleague who's part of the INTAC team, Gia Kelly with Change Matrix, who's a change specialist with that team. And so I'm going to go on and turn it over to Gia and let Gia kind of tell you about herself. And so we'll start with Gina and then move to Regine. And then we'll have some time at the end of this presentation for some question and answer and ongoing discussion.
Awesome. Good afternoon, good morning to you all that have joined us today for this webinar, wherever you are in the world. It is a pleasure to be able to share with you all a little bit from both my professional experience and my identity as a clergywoman. And so as David has already stated, I am employed with Change Matrix as a change consultant and TA provider with INTAC and some other federal technical assistance centers. But I've been a part of clergy or an ordained minister for over 20 years. And so that identity really shapes me as a whole. But I think when it comes to the issue of mental health as a former clinician, as a clinical social worker, it is a very, it's a topic that we must address because I think, as we know, faith is very, very important in the lives of so many people in our country. And so when I say faith, I'm talking about, you know, my identity is a Christian faith, but whatever faith that is for folks. But I believe it's the Pew Forum, you know, suggests that between nearly 8 in 10 Americans are religiously affiliated in some way. And so we know that most of these will, you know, really seek help in times of trauma, in times of mental instability, in times of just stressful situations. Most of these people will find comfort in their, you know, congregations, in their faith leaders. And so it is imperative that clergy not only advance, you know, mental wellness in that they have correct information, or making the right referrals and such, but also really viewing their own emotional health and mental health in that same way. So we'll hear more from Regine about specifics around clergy burnout and compassion fatigue and such. But I can tell you from my experience that I believe this area is an area that must be shored up a bit for many reasons. The first thing that I'll say is that religion can be, I like to say it like this, either a roadmap or a roadblock. And so when I say roadmap, I'm really talking about, you know, clergy being able to support those that are experiencing mental health issues, or whatever the issue is, but particularly mental health for this conversation, to empower, to support, to give information or holy scriptures or something that really speaks to the situations, provides solace in a way for those that are going through, helps them to connect with the right resources. But religion or faith can also be a roadblock. And when we think about roadblocks, we're really talking about something that creates a barrier. And I believe that most clergy want to be roadmaps. They want to be able to point their congregants in the right direction. But sometimes because of misinformation, because of this idea that spiritual counsel is the same or just as good as or better than someone who is trained as a clinician and has the correct credentials and experience to provide mental health services, sometimes it gets a bit murky. And so that roadblock, that clergy as a roadblock begins to misuse sacred texts to give false information. You don't have to worry about medication. You don't need to see a therapist. Just pray about it, right? We've heard that kind of stuff. Just have faith and you'll be able to overcome. And in some situations, again, that may come from a right place. It comes from a heartfelt place. And many think that they're doing something that's helpful. But we know that that's harmful because that's not enough for many people that are struggling in this area. And so it's also a roadblock when they fail to have relationships with clinicians and really refer to those who have a history of good practice. For many people of faith, they want to have a clinician who at least understands their view of faith, right? And so I think that clergy really have to be careful and be skillful at making connections in their community, because we see houses of worship as really an asset to communities. We see them as a pillar in communities. They provide resources. They are kind of what holds a lot of things together in many communities. But when we don't move outside of the physical building and really make the connections and sit down with clinicians in our community and say, hey, tell me about, your style. Tell me about your experience. Tell me about your experience in working with people of faith. Then we can begin to make those warm handoffs to clinicians who we would go to ourselves. And so without doing that, without having the proper information, without having resources available in our churches, in our places of worship, to say, hey, these are some clinicians that we vetted. These are some clinicians that I think might, suit you best, who are people of faith or who at least can have conversations about faith. Then I think we do a disservice in that regard. And so we have to now shift clergy again from being roadblocks to being roadmaps, pointing people in the right direction, supporting them as opposed to creating a barrier. And we know that there is a lot of shame and there is a lot of stigma still around mental health, even though I believe we've made some really good progress. There's still a lot of ways to go, particularly in the African-American church. I can speak to that. It's still not something that we necessarily talk about every day. And we see that there's a lot of movement to talking about and destigmatizing therapy. Usually I would have my t-shirt on that says Jesus and therapy, right? Because I'm constantly trying to put the message out there that it's okay. It's okay to seek help. It's okay to say, hey, I have anxiety and I need some assistance. That makes me no less of a believer. That doesn't mean that I don't have faith. That doesn't mean that somehow something is intrinsically wrong with me or whatever, that, I'm somehow different than anybody else. But we have a long way to go in that regard. And so again, shifting from the roadmap away from the roadblock to the roadmap, I think is essential. As a clergy woman, and again, someone skilled in the area of mental health, I was fortunate to be a part of a congregation for a very long time that really would allow me because of that expertise, to kind of connect folks with services. And really kind of do some of the initial conversations with folk. A lot of my experiences around those who've experienced domestic and sexual violence, as well as mental health and any kind of trauma. And so I had a leader who understood the limitations that he possessed in that area, and really allowed for those with the expertise to really take the lead. And so I was very fortunate in that regard. But I have come across a number of clergy leaders who see themselves as the ultimate authority on all things, and that can be problematic. There is a space for spiritual counsel, right? And some have spiritual counseling credentials, they've gone to some kind of training, but that is not the same as being a licensed mental health professional. And so that is another aspect of this that we have to put at the forefront, really educating clergy on the differences. I don't think one is better than the other. They can absolutely complement one another, but I don't think, again, that they are necessarily interchangeable. And so that education has to be put out in faith communities so that they understand the difference, and where their counsel around, faith and scripture and God and worship and all of that has a place in the life of a people of faith, but it is not necessarily what is needed when someone is going through a mental health crisis and really needs support in that area. It can absolutely support, but it cannot overshadow the need for a clinician and possibly medication or whatever is deemed necessary in that situation. That sometimes can get very gray. I put this on Facebook one time. I'm a social media person, but I just literally thought people needed to know this, right? And so I began to identify the difference between spiritual counsel and mental health therapy. And this thing blew up, because I have a lot of people of faith that follow me. And so they're like, we need, they didn't know this. They didn't know how to really sparse out what's the difference. And if I get one, am I not good? Like, how do I know in which situation I may need to see a therapist? And so I put some really, really simple examples of, when you might need therapy versus spiritual counsel, and how they can also complement one another. And so I think that education, again, is very, very, very important. I think we have to also talk about implicit bias and how that can come into this conversation, because where a faith leader stands on mental health and their understanding can absolutely create a bias in what they say about it, how they promote it or don't promote it, what they say across the pulpit. And we know, for those that are, have ever gone to church at one point, what the pastor or the leader or the faith leader says across the pulpit, many people take as, that is it. That is the final authority. That is God, And that can be very problematic if the information that is being shared is not accurate, is not helpful, is not rooted in research, is not based on factual information or knowledge from those who understand mental health. And so it's imperative that we create educational systems and webinars like this that really reach out to clergy to begin to not make them feel bad or anything, but really to say, I want to build your capacity in this area. And there's a number of areas where this is important. But I think mental health is one of those spaces that it's critical in this moment, especially we are in a pandemic where we know that rates of mental health is skyrocketing. There's a lot of stress. There's a lot of things happening currently that people are not necessarily prepared for, or we were not prepared for. There's a lot of grief. There's a lot of loss. And so I think that it is a prime time for people of faith and clergy leaders to be able to have conversations with their congregants about this and about the need to take care of themselves and the need to get assistance if they need it. And then before I hand it over, I'm not sure how much more time I have, but before we hand it over to Regine, I also want to say that one of my areas of passion is a really helping clergy to understand their own emotional health and the need for that, the need for self-care, the need to be able to identify and become aware of what they're experiencing, to really understand what that secondary trauma looks like, what compassion fatigue looks like. As a former domestic violence advocate and sexual violence advocate, I know that very well. Anyone who's dealt with, any people that have gone through trauma. And so I believe that we also must, help clergy to also do their own work, because they are burdened in so many ways with not just mental health issues, but people that are experiencing homelessness, people who are going through, familial dysfunction. I mean, you name it. The first person that many people call is their pastor or their faith leader. And so to be pulled in multiple directions with multiple needs, it can really exhaust a person. And oftentimes clergy, their cup, so to speak, is very empty. And so they're pouring from an empty cup. And so as much as we can build their own awareness of their emotional needs and their need for self-care, I think it'll be better off for congregants in this area as well. And so I know we're going to have time at the end for some questions, and I would love to be able to answer any questions that folks might have. But that's all I have for right now. And so I'm going to hand it over to Regine for more information. Thank you.
Hi, everyone. Good afternoon or good morning if you're still in that time zone. Ms. Kelly, that was an amazing background. Thank you so much for starting with what you see in your life and the points that you held up. Some of them will dovetail with things that I'm going to present today. So I'm very excited about that. And you all, I do have some slides and some data, but I want to start just talking to you and telling you how I came on this journey, because I think it holds up and shares something that you ought to know about clergy. So I never thought I would study clergy. I really was, I understand many of you have ties to SAMHSA funding, and I was funded by SAMHSA. I was working with people living with HIV and AIDS and working on substance abuse treatment. And I had a colleague who said, oh, we just got a grant in Duke Divinity School to study the health of clergy, and they don't have a researcher, and it's a new thing that the Duke Endowment wants a researcher. Would you be interested? And I said, no, are you kidding me? Clergy should be in a privileged position. So I said, clergy, they're educated. So many of you know this, but in case you don't, a lot of clergy have at least a master's degree and master's in divinity, and it's a 3-year degree. So it's pretty intense, and a lot go on for their a doctoral degree, a DMin, or some other kind of degree as well. And at least with the United Methodist Church that I was being approached to start working with to study, they have health insurance, they have a job. I was like, I'm working with people with HIV, you guys, like a lot of times they don't have a job or health insurance at all. So the health inequities are greater. And then of course, clergy do have a faith community, and there's a large literature out there on how being part of a faith community is related to better physical health. It turns out, the short answer to that, if you're interested, is it turns out that a lot of that is selection bias, that the people who are willing to attend a faith congregation are also willing to do the kinds of things that help keep them healthier. And it's not necessarily cause and effect. But nevertheless, I was like, but they are surrounded by community, and we know that having social support makes a big difference for all of us. So I was like, I really can't see doing this. And then she said, well, we got $12 million. And you guys, I was so upset. I was so upset on behalf of the people living with HIV that I was trying to work with, who I was struggling to get enough money to take care of, that I was like, okay, let's find out how clergy are really doing here. And I asked what evidence base they had to get this large grant. And they said, well, when you look out at clergy at the different events that we're going to, it looks like they're gaining weight. This was 2007. I was like, we are all gaining weight. And then it said, you know, their health insurance costs are rising. Like, everybody's health insurance cost is rising. I was frustrated, but I've got to tell you, we did the first study, and I'm going to share some of those data and then the subsequent waves with you today. We did the first study. So I went to the bishops of the United Methodist Church in North Carolina. And so that's where a lot of my data and findings are limited to, although I do read about every other clergy group that I can. And asked them if I could sample. And they said, you can't sample. It's all of us or none of us. This is a connectional ministry. And that was my first lesson. And then my second lesson was, I did an hour-long online survey in 2008. So, I mean, that is boring and asking a lot. And I had been told that clergy are so busy to keep it to 20 minutes. But I said, you know, to get at holistic health, I've really got to make it longer. 95% of the clergy in North Carolina of the United Methodist Church did it in that first wave. And we're now in our 7th wave, just closed on Halloween, and 72% of the clergy are still taking it. So these are high enough response rates that I have confidence that what I'm telling you is really representative of North Carolina United Methodist Church clergy, and I'll come back to that in a second. So I learned all these lessons, and I've got to tell you, we put the same questions on there that we put on there for that the Centers for Disease Control and Prevention asks of each state through the brief risk factor surveillance system questions, so we could do a fair comparison. And clergy are worse off, y'all. I was so surprised. It was not at all what I would expect for those other reasons that I had just named. But as I will show you today, I learned that clergy have both above average rates of chronic diseases and depression symptoms, and a few other things that we'll talk about. So I was wrong, and I've been spending the last 14 years chasing why was I so wrong, and what can we know? And part of what I've come to is that clergy are special and that they are called. Now, I bet a lot of you here are also called, and I don't think that clergy are the only ones who are called. But when your work is sacred to you, so see if you recognize yourself in this, you are more likely to, you're going to overexert yourself. You're going to overextend on more days of the year than if your work isn't sacred to you. And you are going to fiercely protect what you do. And so you're kind of hypervigilant about everybody's needs and keeping your group strong. And if things go wrong, you can go to a place of feeling really desolate. And that is a stronger feeling than, say, many of my colleagues in academia who really do care about what they do, but they might not hit rock bottom when things aren't going well at work. So I think that's part of what makes clergy special. And I want to tell you a little bit. Let's see, what do I want to start with? But I want to start with, this isn't the whole story. So I just held up some bad news. There is also some good news. And I want to spend a minute now trying to help you see perhaps how clergy spend their time. Because a lot of us, and me included before getting into this work, thought that clergy spent all their time writing their sermon or their worship. And it turns out that they've done time use studies with clergy. Clergy do put 15 to 20 hours into a lot of sermons. I won't look at Gia to see if that's how much she puts in, but clergy do put in a lot of time. But that is actually a small bit of what they do. Our studies indicate that full-time clergy work at least an average of 53, 55 hours a week. That's a long week. And some of you probably do that too. So, every hour after 40, it really starts to cut into a balanced life. And they've done studies on multiple faiths and denominations with that, and Catholic priests are even worse. It could be that their parishioners think that they shouldn't have another life because they're not married and don't have kids, and so they get pulled on a special lot. We'll see. Okay, so I'm going to go ahead and share my screen and let you see. I have to wait for this top toolbar to disappear so I can start sharing. Hold on. It's not going to let me go. There we go. All right. So I hope you're just seeing one slide, right? And not the one that's coming next. Okay. Thank you for those nods. All right, great. So I want to give you a little sense about the day in the life of a pastor. So this is a Facebook entry that we found of a Presbyterian pastor. 12-hour workday, 3 committee meetings, breakfast meeting, lunch meeting, working with the music director. Believe it or not, the pastor has to help tweak the sound system. I hear things like this all the time. Working on Confirmation Sunday, 3 dozen emails, 12 phone calls. This is common. Various conversations with folks about new members, revamping the website, raising money, having retreats, Sunday school classes, and one member who asked how my family is adjusting to the move. This is a really big plate, but here's what they added. Honestly, I get to do this for a living. How awesome is that? And so that's the space that clergy want to be in. And many clergy are. And I'm going to show you a little data today on flourishing clergy. This person, I think at this moment, is flourishing. But you can also see the risk with all of that. They have a really fragmented day. You can feel like you didn't quite accomplish anything because you don't necessarily get to anything to completion. It's a lot of interpersonal work, which also has its own challenges. So what is special about the work of clergy besides being called? So they are in charge. They care about it a lot. It is complicated because you're dealing with people all the time. There are unpredictable things that unseat each and every day that you just don't expect. Clergy are very much on display. They're not just their work life, the way my work life's on display, but my home life isn't. But clergy people are like paying attention to everybody in their family. And then the criticism that clergy get, this is one of the things that has surprised me over the years, but so often someone will finish preaching and on the way out of worship, one of their congregants will come and tell them something that they're unhappy about. And they might not recognize, they might not even say, oh, thank you for that beautiful word today. I'm in a new space because of it. No, they just come like right in and say, I don't like the bulletin. I don't like the new color of the pew cushions. I can't even tell you how often I've heard that one. You didn't mow the lawn. Like the clergy out here, they don't have a lot of helpers. They don't have staff. It's hard to have enough money to run a church. And so, they get criticized for all kinds of things. But what we have found is there's this general social survey for the entire United States. And of all the occupations, the clergy indicate that they are most satisfied and happiest with theirs. And I used to think like, oh, they're just saying that because they have to, because, you know, who's going to rebuke God? You've got to say that. But I don't think so now, after many years into this. I think that just because they have a lot of challenges doesn't mean that they don't actually love their work. And a lot of clergy really love their work and can cycle in and out of burnout and get back into the place where they love their work. Some of the things that are making it harder on clergy these days is what do we prioritize right now, especially that third thing about the external changes. All religious institutions in the United States are shrinking right now. And there might be some movement to some mega churches and some movement to some non-denominational churches, but by and large, well, actually, maybe the Catholics might be one exception with the Latinx congregants, but still, by and large, it's shrinking, and that puts so much pressure on the business model of like how to keep church doors open. And then, of course, everybody's texts everybody's writing on Facebook, everybody's communicating in a way where it's easy to slight other people and put them down and not be in a thoughtful relationship when you criticize. And then it's done publicly, which can lead to a lot of shame or embarrassment. And clergy experience that. And as I said earlier, they really care about their work. So they can feel a sense of desolation when that comes. All right, on to some slides. But first, I have to tell you, the other thing that we have found is that where there's been studies of clergy have been primarily in the US, primarily Christian Protestants, mostly mainline Protestants with some evangelicals, and mostly white people, white clergy. And that does not necessarily reflect who is actually clergy out there. And I myself am funded only because of the generosity of the Duke Endowment, which is tied to United Methodists. I've been able to study United Methodist clergy. And in North Carolina, which is quite a racially diverse state, it's only 6% African-American United Methodist Church clergy. So when I talk to you about anything with African-American clergy, I'm relying on about 120 clergy, which isn't very big, whereas my other samples are relying on about 2,000 clergy. I am pleased to say that I just started a project with AME and AME Zion church clergy, and we are going to be able to learn from them as well as providing a program and intervention. So I'm trying to change that, but these studies haven't been done. I can't find any studies on rabbis. I can't find any studies on imams. I have a postdoc right now who is doing an imam study in Pakistan. So very different context, but so when I'm talking about faith, I really am talking about Christians, and it's not because I wouldn't like to be talking about other faiths, but just to be transparent. And just say there's need, big need. Okay, so what do I have to share with you? All right, I am going to be talking a little bit about depression and anxiety, and I just want to clarify that stress is different. So, stress is when something happens to you and you don't think you have the capacity to meet the new need. And burnout comes, and it can come when you've been stressed for a long time. But it's a cluster of feeling emotionally exhausted and like you're not accomplishing anything. Those are different. Those are not clinical diagnoses, and probably many of you know this already, but just want to hold that up, that those are different. There can be areas of concern, but they're different from depression and anxiety, which have specific definitions and specific symptoms that you can look for in time periods and that kind of thing. So what have we found? Hold on a second. With that study, that first study all across North Carolina, I actually wanted to be able to compare to the NHANES, this big national nurses study out there that has a representative sample of people in the United States, but they did their interviews in person. So I did phone interviews, and here you can see the 88.7% of UMC clergy over a decade ago would have qualified for depression on a screener, like concerning scores on the screener, compared to only 5.5% of the US. Once we made the match for being employed at race, gender, and a couple other things, insurance status, I think. So that's disparate. Now it's not like 20 percentage points higher, but it was enough to concern us. And so here are the different waves of data, except for the one that we just finished that isn't clean yet. And you can see the symptoms of depression here to the right. And so actually in North Carolina, depression symptoms were trending down until 2019. And you all remember back to 2019. I mean, it was pre-pandemic, yes. There were some political things going on in our country. There were many reasons for concern and for depressive symptoms to go up. And we also saw anxiety symptoms go up in 2019. And across the board with the symptoms that you see here. This was all pre-pandemic, so I'll get at the pandemic in a second. And then in terms of burnout, I want to call your attention to the red parts on the bars. This is the percentage of clergy experiencing a cutoff score on the Maslach burnout inventory that would have them have high burnout. And so you can see it bumped up to 17% in 2019. I have to say, like, that's, glass half full, half empty. Like, that's almost 20%. I don't want clergy to be burned out at all. I'm worried about that 17%. At the same time, in 2019, some medical provider studies were suggesting 45 and 50% burnout amongst medical providers. I did this whole other study comparing burnout around the world in clergy to teachers, social workers, police, EMT, and clergy were better off than police and EMT personnel, but on par with teachers and social workers. So I don't know about you, and there might be a social worker there in the audience or two, but you are not known for having the best rates of burnout. So I don't know if that's great to be matching teachers and social workers, but I do want to say it could be worse. And here's what we have learned in a nutshell about physical health. So this is like comparing matched to the population in North Carolina of our North Carolina United Methodist Church clergy. And you can see the yellow bars are clergy, and in each case, they have worse disease. And I believe it's driven by stress and by obesity itself, both. We've looked at this separately for the African American clergy in our sample, and kind of not surprisingly, African American clergy are even worse still. And I think you all are probably aware of how that is true kind of nationwide, that African Americans have a higher disease burden. But when you look at our mental health indicators for, not for stress, but for depression and anxiety symptoms, African American clergy look much better, actually. And that is true of non-clergy as well. And so it's a bright spot. I think it does speak to coping. At the same time, we need to take really good care of everyone doing ministry and not expect African American pastors to have to do more or struggle with less. Okay, being conscious of time, I'm just going to say we had some studies that let us look pre-pandemic and then during the pandemic, like from April to April, and I have just one slide here to show you how clergy ended up doing, which these are our United Methodist clergy in North Carolina again. So take a look at that blue line. What you see, it starts there at a score of 1, which means for this these are change scores from 2016. So at 2016, they got worse by 1 point on the anxiety measure, which is a 21-point scale between 2016 and 2019. And then they went up again by about 0.6 more points. Or you can see with the depressive symptoms in green that from 2016 to 2019, they'd gone up by 0.4, and then they went up by another 0.5 on a 24-point scale. Whereas 2 forms of burnout just stayed flat: emotional exhaustion and depersonalization, which is being cynical. So, it's kind of a question, like, how much should we be concerned about these increases? And I will say in the first 10 years of our studies, we didn't see any increases. So this is different, concerns me for that reason. On the other hand, given everything that's going on and what the pandemic caused, you could imagine this skyrocketing, and it did not. There are other studies about clergy during COVID. So in the United Kingdom, Anglican priests said, like, this was kind of early during COVID. It was in July of 2020 that they were experiencing more stress and exhaustion. Some felt happier, some felt less happy, some were more creative. You all had your own experience of COVID. It's kind of a mixed bag sometimes. We also interviewed clergy in the heart of it in summer 2020, and we found a couple ways in which they were different. So clergy talked about losing what they usually do and spend time on, which is leading worship in person. That was hard. And it can create burnout when you stop doing what you find meaningful in your job. Anytime you're doing a lot of administrative work, like, unless you find meaning in that, it's much harder. It puts you at risk for burnout. And we learned that clergy are really renegotiating their roles. I mean, they really had to become, they still are, the determiners of, do you wear masks or not? When do you come back in person? Do people share their vaccination status or not? Like, this is something that clergy are grappling with and have congregants with different opinions on every day. That was a new role. And we heard a lot about practical changes to ministry. All of this going live stream and Facebook Live and all of that. It's a really big deal. But we did not hear people fundamentally changing any of their core values about what ministry work should mean underneath. All right. I really want to take you down one more road, which is like, how do we get out of the cycle of burnout and depression? And I've been trying to figure that out myself. And it has fundamentally changed the way I see the world by understanding about positive mental health. So I really want to share this with you because I used to think about the world more as you could have mental health problems and we wanted to get rid of those. And now I see it much more from, but what do you have the presence of? And what does having the presence of positive mental health look like? So here, Corey Keyes, who I didn't know at the time, now a close collaborator of mine, has defined positive mental health as having high levels of positive mood every day. Mood is how you wake up. Emotions are what happen to you as different things happen to you throughout the day. But also good functioning, like having meaning in life and feeling like you're growing as a person. And good social functioning, which is feeling like you're making a difference in this world and like you're part of society or part of groups, like you belong. If you have those, then you have the presence of positive mental health. And if you have them at high levels, we can call you a flourisher. And if you have them at kind of moderate levels, you can have moderate mental health. And you can be absent them, and be considered a languisher, which does not mean that you have any kind of mental illness or mental health struggle, but it puts you at risk for that in the future because you don't have the presence of the positive mental health. And so here you can see with clergy on the left in the blue, 68% qualify as flourishing. And that's better than the nation, which is 53%. So that is some of the good news for clergy, because high levels of positive mental health now indicate they mean that you're less likely to have new depression, new panic attacks, new anxiety disorders in the future. And you're also likely to have better physical health in the future, as shown here. Why? How does this work? And so we've got this great theory by Barb Fredrickson, who's a social psychologist now at University of North Carolina. And here's how it works. So people with high positive mental health start their day with they have more positive emotions on a daily, regular basis, just a little bit more than other people. When you experience positive emotions, it allows you to open up your mind to new ideas. And it also allows you to be a better problem solver. So for example, in lab studies, you can give people, you can have them watch a 45-second video of penguins. Apparently we love penguins, y'all. And after you watch the video, some people can watch the video and some people will not watch the video. And then you can say, here's a problem, write down all the solutions you can think of. And the people who see 45 seconds of something humorous that makes them smile are able to come up with more solutions and more creative solutions as judged by people who were blinded to which group folks were in. And so once you become more open and a better problem solver, you're more likely to interact with other people, which we know can be good for us when you feel socially connected. And kind of over time, because you're open to more ideas and experiences, you are more likely to take that extra class, to read something extra, to really listen when someone's talking to you. So you end up with more knowledge. And because you're a better problem solver, you persevere more and you're more socially connected. And as I said, this leads to better outcomes in the future and really kind of gets at the heart of resilience. So I'm just going to breeze through here. If you are a flourisher, the flourishing clergy have this going on in their lives. They are more likely to have congregants who are open to new ideas, they're supportive, and they have higher spiritual well-being. Whereas clergy who have depression and anxiety symptoms, they're getting criticized a lot by their congregants. Their congregants are making too many demands on them. Their schedule's really unpredictable. And then both are related to having higher levels of financial stress is not good for you. Social isolation is not good for clergy. More social support, of course, is good for clergy. In the interest of time, I'm going to skip through a couple things. Flourishing clergy, in this in-depth qualitative study we did, do 4 things that clergy with burnout do not do. So flourishing clergy, they take time for themselves. They also know they have health goals, whether it's to walk every day or do spiritual devotions every day, and they make a plan for when they're going to do it. And they also realize that their plan is going to be interrupted by the unpredictable work of ministry work. And so they make up backup plans to still meet their health goal. When they're criticized, they don't listen to all criticism. They put it through the filter of what has God been asking me to do lately? Where am I leading this church or other faith organization? And then only then, if the criticism is relevant to where they're headed, do they take it to heart. Otherwise, they're able to let it kind of roll off them better. And then finally, while we know getting support is always good, what's interesting is that Flourishing Clergy actually share their good news and tell their happy news to people. And clergy with burnout do not do that. All right, let's see. Okay. I want to get to my last couple slides here, which is to say, now I know you all are here because you care about congregants, you care about youth and adolescent and child mental health, and how do clergy show up in the lives of their congregants, and what kind of space do clergy need to be in to show up. So so as Gia Kelly put so well earlier, it's like having clergy who are burned out can really be a problem in terms of them making enough connection within their ministry. And I put to you here that Flourishing Clergy can help them reach out and connect more, and also broaden out their thinking and help them be more creative, which is what I want for to see within my congregation. We've made this. So the other thing that I want to say is a lot falls on clergy, but clergy work in communal spaces. Congregations are full of many people, and it shouldn't be all on the clergy to do everything. In fact, one of the hardest things I think about being clergy is that you are trying to motivate an all volunteer workforce. Like I've had so many clergy say, oh, I used to work like with a Fortune 500 company, and that was so much easier because I could hire staff with the right skills, and if it wasn't working out, I could give them an employee improvement plan or fire them. And you can't do that in a congregation. And so it's very challenging. So if you are part of a congregation, or if you're a mental health provider and you want to partner with any congregation, there are lots of things you can do. So one thing that we have found helps clergy have better positive mental health is when their congregants ask about them as a person. Where are you going on vacation? What are you reading these days? How's your brother doing? Like, ask them not just about religious life and faith, but like how they really are as an individual, and help them feel seen as a whole person. Also, think about when and how to criticize. If you have a criticism, take your faith leader out for coffee. Say, I care about, our church, our faith organization, and let's really talk about this. And then it's private and it's personal, and it's going to go over much better. For children's mental health, like, you can offer to find a speaker to come to the faith community. You can offer to plan ahead for, a lot of Christians have Lenten series where they might have 4 or 6 different speakers, or where there might be certain actions or behaviors as the congregation they're taking during that time. So plan ahead to hold up, adolescent mental health during that time. You have to plan that ahead months in advance that you can do it. And then, a lot of faith communities have referral lists. Some don't have them really written down. Others do. Offer to spend time to really fill out a full list. And to make it trusted sources, trusted, culturally relevant sources, so that the clergy have faith in who they're referring to. With my new program with AME and AME Zion Clergy, one thing that we're going to be doing is teaching on clergy when to refer, how to refer, and who to refer to, and updating those. And a lot of clergy, they'll just take it on, and so that hesitancy to refer is both good because they really care, but sometimes it means that they're stretched too thin, or that there is some doubt about when is a congregant's need going beyond the clergy's ability to meet it. The other thing I want you to know, I had the stereotype that all clergy had some kind of clinical or counseling training. At Duke Divinity School, only 30% of the students go through clinical pastoral education, or CPE. Only 30%. So 70% haven't even had a class on it. So you cannot assume that your clergy leader, they're skilled with people, but they may not, they need to be referring out more, and they could use some support in doing that. And then, mental health providers, really, a lot of clergy would like more connection and collegiality, like to talk about how to collaborate on care, like how can we help each other? When do we refer to each other? What's off limits? Like, what do we not talk about? When do you not talk about faith and you not talk about mental illness treatment, if it's really mental illness? Yeah, and then right, and mental health providers can come to a faith community and give talks. All right, I also have, over the last few years, have been approached by many people with some ideas of how to change the church or the faith community. So, like, for children with autism, can you have a space with a room, a safe sensory room for them? Like, if you don't, then often children with autism won't feel like they can come. And children with ADHD often can't sit still during a worship service, and then their families start feeling like they're not welcome and they can't come. Now, of course, with online worship these days, you can plop your children down and feed them waffles during the sermon. But that used to be much harder, and there is still something special about showing up in person. You all, I'm sure, have thought before about how weekend programming is very helpful social options for teens, keep them out of trouble and give them good values. And then I will say last, I'm part of developed a series of, I've got a program now called Coping Together, where we get parents and children and families to learn how to communicate with each other more clearly and around difficult topics. And we've got it scalable with videos and lay leaders providing the actual sessions with families, like having something that promotes good family communication can be good for child mental health. Phew. Okay, we still have time, y'all. This is part of my team, and I just always have to thank the Duke Endowment. We know what we know because of them, and because of my team here. Let's see. Let me turn it over to David. And
great, thank you so much, Regine. Gia, I so appreciate your expertise, your wisdom on these topics. The research that you're doing, I think, is just inspiring as well. And it's great to be able to have these kinds of conversations, just because, again, I don't think they happen very often in congregations and faith communities. But I do think, as you've both have pointed out so eloquently, that they do have an impact on child and family mental health in some really significant ways. And I appreciate both of you for being able to provide some real concrete strategies for being able to think through some of these topics, but also some strategies that we can use for hopefully helping to improve some of this communication and actions that can be taken within our local communities as well, to continue building these systems of care. And so we're going to open it up for some question and answer. I'm so appreciative for both of you again. As we do so, one of the things I want to, I'll start us off with questions. If you have questions, also please feel free to jump onto chat, jump onto the chat. Jump onto chat. Feel free to come onto your microphone as well if you want. I'm really excited for us to be able to continue this conversation for just a little bit. And so Gia and Regine, I'm curious, what are some of the challenges that what are some of the ways, I guess, that you see this potentially impacting youth and families if clergy aren't taken care of? So just kind of making that link. What are some of the things that happen to youth and families if this kind of support for clergy doesn't exist? And that may be based on the research, or it may even just be kind of conjecture rather, of what it is that you would guess. But just in your experience, what are some of the things that you see youth and families are sometimes experiencing in congregations where these types of conversations aren't happening and where clergy aren't necessarily being supported?
I think one of the things that is problematic is the suicide rates among clergy. We have seen a lot of that as well, and just the overall health and well-being of leadership. And so if the leadership is not healthy and happy, again, they can't pour from an empty cup. And so that begins to trickle down in their ability to really be available, to have that flourishing mentality that Regine was talking about, really loving what they do. And I think people feel that. And so it's more out of, kind of survival mode, just to keep things kind of going, versus really enjoying and enjoying being around people and doing the work. And so I've seen quite a bit of that. And so just doing it because it needs to be done rather than doing it from a healthy place. And so I just think we're better, all of us, not just clergy, but whatever our role is, even therapists. When a therapist is going through their own, mental health issues or not taking care of themselves, it's going to come out in, how they serve other people. And so I just think that's the kind of basic answer to that question, and just overall unhealthy leadership and what that looks like, stressed out leadership.
And I just add, I've been talking to some AME Zion clergy lately in North Carolina, and I've been asking them about their referral lists, especially around mental health, and do they get inquiries for referrals or parishioners who they want to refer? And they say, yes, they do. They do get the inquiries. And I said, okay, well, how do you figure out who to send them to? And a couple clergy have said that they don't really have a list, that they know people, they've got personal relationships with therapists in the area. But sometimes it's not a good match because you've got specialty, like, will somebody see a teenager? Will somebody see someone who's under 10? Will somebody see someone with this issue? And then these clergy said that they have to spend time figuring that out. And what I think probably happens for all of us when we're burned out is we feel overly busy and things are harder to do. And it's just going to take longer to get around to that referral. You're going to be less creative in who you reach out to, and you've got less energy to call people until you figure it out. And you might take you longer to get back to that family. So both the clergy I was talking to recently said that they have several referrals that they're still trying to get to.
Yeah. And I think too, it's important to add that, in Regine's research, the Methodist denomination, there's more, even though not, a whole lot of resources. These are people that are salaried and doing this on a full-time basis, but in a lot of, African-American denominations, there's a lot of disparity there. And so some of them are doing it for nothing. They're working a full-time job in addition to pastoring those hours that we talked about. And so just imagine how much more problematic and stressful that is, in addition to having a family. And so what we see a lot in African-American congregations is the pastor just carrying the weight of about 10, 20 people, and that then affecting the health, the mental health, the physical health, et cetera. And so that's also something that I wanted to bring into the space, because that looks very different when they have the lack of resources on so many levels and that lack of support, which then turns into why the data is so low around them not getting the training and all of that, because we're trying to just keep the doors open, They would love to have the backing of a Duke Divinity School or something like that, to be able to pour resources. And so that's another conversation, but I wanted to absolutely highlight that as well.
I'm trying to hire 2 clergy now for program directors, and every single one, they're all AME and AME Zion clergy, have a full, are like, they have 2 full-time jobs. They are full-time as the lead pastor at a church, and they have a full-time secular job. You know, as an engineer, is probably someone we're going to hire. I mean, like it is remarkable. And everyone's what's called bivocational. Everyone in those denominations have more than one job, and so the ability for burnout is much higher. Among the United Methodists who have more resources, if they are bivocational, they actually have slightly better mental health and slightly lower rates of burnout, because I suspect it's when the church is mean to them, they have another role that's going better, you know, or maybe churches expect a little less of them. And so they can say, oh, I can't do it because I have to have this other job. But I don't think that that's what's operating in the AME and AME Zion churches.
You know, I really appreciate you saying that. And as I am listening to you all, you know, I'm reminded a few years ago, I think Reverend Howard John Wesley out of Washington, D.C., I believe that's where he is, quoted and gained quite a bit of news for a message that he had given around a sabbatical and the need for a sabbatical. And this was a sabbatical he took after, I think, 30 years of working in this position, and it happened to come right before the pandemic. But it was a message that I think really stuck out to me in really just kind of laying out some of the challenges that he was experiencing and some of the things that he was seeing as a result of not being able to have that sabbatical. And later on NPR, I think he later detailed after the sabbatical some of the things that caused him to realize maybe the importance of the sabbatical and some of the things that he learned from that, but also even what some of the fears were associated with taking that sabbatical and the idea of needing a break, and this kind of ongoing question of, well, what does the congregation think? What if people leave? What if they can do without me? And so I'm going to post that in chat just as a link or a resource of his interview that he did afterwards. And then I want to make sure that we have a little bit of time to answer these questions in chat as well. So Suzanne, I think, had asked this question: do you think we need LCSWs or master's degrees to collaborate with clergy and mental health practitioners? And can we speak to the church at large about this challenge?
So I absolutely agree that we can speak to the church at large, the universal church, not just, you know, one aspect or one race or whatever. So absolutely. And as far as the need for, for licensed clinical social workers or master degrees, I guess I'm a little confused about that question. Can you clarify that, Suzanne? I'm trying to understand exactly what you're asking. Does who need the LCSWs, the church, or does the person need these credentials to work with the churches? I'm trying to make sure I understand that. And please feel free to unmute if you can.
So I see in chat, Suzanne said she has her undergrad from Colorado Christian University.
Hi
in
there.
music.
Hi, I unmuted. So
Okay.
I am a mom with a child that has special needs, and he's 23 now. And our greatest source of challenge was church was just not a place he could thrive. And so my husband and I, thank God, are both believers and both avid churchgoers from our infancy. So we've stayed involved, but my heart is to challenge the church to embrace, as you're saying, the whole concept that yes, we need Christ, and yes, we need Jesus primarily, but we also have those with mental health challenges, and we need to reach them and love them equally, not simply avoid the topic or ostracize because they don't fit the mold. I feel a great deal of passion to speak that into our churches, because I feel like we've missed this. So I guess I wonder, do I need to get another degree? Do I need to credential what I'm saying with an LCSW degree?
Okay, I totally get it now. So you have lived experience, right? I think that that is critical to being able to talk about and bring awareness to this. You know, you understand the challenges firsthand having a son with special needs. And so, no, I don't think in order to be an advocate for mental health or for more inclusive kind of atmospheres in churches, absolutely not. But if you are trying to provide services, you know, mental health services, then absolutely we would want you to have that background. But to be a voice and to speak, bring awareness, you know, no, your lived experience is by far enough.
Awesome.
If
Thank you
want
very
that
much.
experience, you know, if you want that background, then it's up to you. But I don't think it's necessary for what you're trying to do.
Thank you.
You're welcome.
And to those church structures, like your lived experience, like what would have been helpful for you and your family with when your child was younger than 23, and then what would be helpful now? And there is a church here in Rockville, North Carolina, that's trying once a month to have a service that's very friendly for children with ADHD, autism. And I know you're talking about mental health issues, but any of that. And before they started doing the once a month service, they led up with various speaker series to try to get, and the pastor preached on it. So they like tried to get everybody a little bit educated first, and then they're trying to say, okay, it's just once a month now. And on the other 3 weeks, they have a separate worship going on in a room next door, so that there's always a place for worship for those children.
My child has PDD-NOS, bipolar NOS, oppositional defiant, and intermittent explosive, and he has an IQ of 130. So he's brilliant, and being bored is a nightmare. So we've experienced both the mental health and the neurologic challenge of church. Yeah, thank you. I just feel so compelled that this is something our churches need to be shifting to a broader perspective.
Absolutely.
I just remember the old ladies as we would come in saying, oh, if they would just beat that child's butt, he would change his behavior. Never would, not with oppositional defiant.
The awareness is key. Yeah. David, I wanted to bring awareness to a powerful statement in the chat from Sharon, who I'm assuming is a clergy woman or person. She says, what about the unique congregational systems that contribute to challenges to flourishing? I use tools that help me flourish, but I'm still tired and sad. The other pastor I worked with had a major meltdown with a member of personnel and mostly talked about a lack of lay leadership and help. So next week, our board will be meeting to talk about this. Both of us feel like time in a cave would feel pretty good right now, but working with the system feels even more overwhelming. And I think that's a very powerful, because you can hear her heart in that you can hear that it's like stuck between a rock and a hard place, needing help, but also needing rest. And so I would always encourage rest, if that's the cave or a vacation, whatever you want to call it. I would encourage, to really gather yourself. Like sometimes we just need time away to be able to regroup and really think this through. So I just wanted to bring, just highlight that we hear your heart in that, we get how hard it is. So I would encourage you to take the time that you need so that you can make the right decisions for you and your congregation. That would be my response, but I just wanted to highlight that because I think that was pretty powerful. I don't know if anyone else wants to add to that.
Absolutely, Gia. I think that I completely agree with you and really appreciate you bringing attention to that statement. I see Mary in chat has also said that more on how spiritual communities engage with lay people would be really helpful. I'm wondering if you all can speak about some of the ways that lay persons can better support better support the functions, I guess, of those faith communities and support the clergy. And so are there best practices, for instance, in being able to train lay people to serve as volunteers, and what kinds of training do they need in order to maybe work with children and youth before we just say, hey, you're a lay person, you're a volunteer, go work with kids. What are the things that those congregations can do or that those clergy, I guess, can do to better engage with lay people, so that it really is a partnership and doesn't just fall on the shoulders of that clergy member?
Yeah, I think it comes down to not having that savior syndrome, that, I have to do everything. And that can be a huge piece of this as well, feeling like the weight of everything is on, or it's not just the leader having that, but just that perception from congregants sometimes too. Like it's all on the leader. So we both have to kind of, congregants and leadership have to understand they all make up the church. It's not just on, the burden doesn't, lie on one person. So that would be the first thing. And I think churches can do a greater job of doing, like, and I've seen it done and had it done, but just really opening up like fairs around like what's available, where areas of need are, really making that not just an annual thing, but monthly, so that people know where they fit and where they might be able to use their gifts and talents. Sometimes people just don't know, they want to serve and want to help, but don't really know how. And so I also think, as far as supporting clergy, that would probably be key, is having people to do and help with, and to take a beam, as we say, because all of us are needed to make things to run. So I think just messaging that, keeping that out there, giving people space to sign up and following up with folks, right? Like not having signups and then nobody's reaching out to say, hey, you wanted to, more information about the children's ministry, let's talk. So I think just everybody has to be able to really invest in that and getting people in the right spots.
Yeah, and I think I'm curious too, and I'd love to hear from both of you on this. It seems like one of the things that's sometimes challenging for clergy is really being able to develop support networks, partially because there's that kind of dual relationship of I'm seen as a leader, and at the same time, you're friends, or you're kind of like family, and that dual role identity crisis can be really challenging at points. And it seems at the same time that clergy sometimes have difficulty being able to form relationships with other clergy members and even people outside of clergy, or maybe especially people outside of clergy, that they're not maybe a clergy member to that individual, but that you're able to have that natural support system, and you're able to have those friendships, and that we're able to model, that clergy are even able to model those natural support systems and how they can be utilized for their congregations, so that there is an emphasis on those supports being available and understanding the value that those can bring. And I'm just curious what your thoughts are on that, and any suggestions you may have as well for trying to, how do clergy do that?
I'll just say some data, and then maybe Gia can say how clergy do it, since you have that lived experience. But like, we have something that's really interesting. So we've got, first of all, in terms of clergy feeling socially isolated in their work, we regularly see about 15 to 20% of clergy in our study say that they are very or extremely socially isolated in their work. And that mimics a couple other studies out there, so of other clergy groups. So that's real. At the same time, we have a lot of social networks data, and the General Social Survey for all of the US suggests that on average, people name 2 people, like, oh, well, I shouldn't have given it away. If I were to ask you in the last 6 months, how many people have you discussed important matters with? The average American says like 2 people, or less than 2. It might be 1.5. It's not very many. Clergy are saying 7 and 10, and I kept being shocked, and I kept rewording the question. I was like, no, not your covenant group, and no, not your. It's not just because you're talking about scripture. Like, tell me, like, friends you go to with problems, and like they actually have, most of them have a fair number of people. what I suspect is that the quality of support they're getting is not as good as the quality of the support that they give other people, that they give parishioners, because they're pretty skilled in that regard. And so then it ends up feeling like there's a perception that it's not rich enough, or that their lives are really just so complicated that they need richer. And then I'll just say, like, what I hear from clergy of different denominations, I think we lost David, is that it's their roles are political and with some competition. And so you don't always want to go and talk to other clergy in your same denomination, because they might decide which church you get to go to next, or they might tell somebody else something about you. And so where we have found the most success is going across denominations. Go ahead, Julia.
No, I was just going to agree with that. I think, that true kind of, again, being one large church versus all these various like silos, it's, and I don't know the answer to how to really, that's a whole nother effort there, because of what you've already pointed out, the competition and all that stuff that happens. But as much as we can lean on one another and really see ourselves as part of one large family, I think the more, we would see some of this dissipate. But there is a lot of segregation, not just racially, but there's a lot of segregation denominationally, just in various aspects for various reasons. And so I think unity, and the unity may come in these awareness kind of campaigns, right? Bringing awareness to mental health that all clergy can kind of get on board around. It's not more so about denominational as much as it is about health. So I think as much as we can bring up kind of universal topics that address, that affects everybody, regardless of race, locale, or anything, it's better. And that can bring unity around some topics, how to serve children. Because I think at the heart of it, people want to do a good job. How do we better engage lay people so that we don't burn ourselves out, so we may just need to focus on those universal messages.
Thank you so much, y'all. I think we are right at time. I'm going to share my screen for us to be able to close out. So as we close out, I do want to thank Gia and Regine for your wisdom, your expertise, just being able to have these conversations. I wish these conversations were more frequent, and the ability to be able to participate in them is really just such a gift. And so thank you to both of you. As we continue this series, we have 2 more series for the fall semester here, or through the rest of the year, I guess. December 3rd, we have a presentation on system transformation, and really looking at faith communities as change agents in system transformation. And then on December 17th, we'll close out this year with a presentation on really looking at how do we partner with congregations and faith communities, and what does that look like with some real practical steps. And so I'm excited about both of these webinars, and for us to be able to continue some of this series. And so again, thank you for attending. We do want to hear from you so that we can continue bringing these types of resources to you. So if you can just take a few moments to give us your feedback. A link to that feedback form is included in a follow-up email sent immediately following today's session. And your completion of that survey is a very important part of our quality control into our future funding for this project, as it does allow for us to continue to provide you with resources and training at no cost. If you could please just take a few moments to let us know your thoughts, it would be greatly appreciated. But again, thank you so much, Gia, Regine, everybody else for attending. Really appreciate it. If you have questions, you want additional resources, please let us know, reach out. You've got our email here in the contact information. Visit our website, download our flyer. We're also available to provide TA as well. And really look forward to talking with you all soon. Thank you so much.